Okay, I think everybody's apprehensive about coming into treatment. People don't know what to expect. Is it a prison? Is it, am I going to be treated badly? Am I going to be, with a whole load of criminal people? And there are all kinds of questions that people have about what the process of treatment would be.
So it can be profoundly helpful to speak to a non-judgmental professional about your addiction problem, maybe as a way to start thinking about what program to follow.
Addiction is a very lonely process, and in treatment we have the opportunity to learn to re-socialize, to learn how to interact with other people, to learn how to have fun without drugs, and to learn how to have meaningful relationships, how to connect with others.
At Houghton House we have inpatient treatment where you stay overnight as a resident for maybe 4 to 6 weeks. In some cases people will even extend that, perhaps into the 2nd or 3rd month.
The first and most obvious part of treatment is getting somebody to safely stop using drugs. And so that's done under the medically supervised detoxification regime administered by our nursing and medical staff.
Whatever treatment strategies that we implement from a medical point of view are evidence-based and safe, and essentially making sure that the patient is as comfortable as we can make them.
Getting somebody to stop using drugs is a difficult part of the treatment, but it is only the beginning of treatment. But developing a healthy mindset is the most important part of recovery, of sustainable recovery. Developing a different way of being in the world and a different way of experiencing reality. We know that effective treatment is contingent on the patient's experience of their relationship with their focal counsellor. And so it's important to have counsellors and therapists in treatment that people can relate to, that people feel cared for by, that people feel understood by. Part of the problem with addiction is the level of dishonesty, the dishonesty with self and with everybody else. In group therapy, people have the opportunity to relate to others, to hear other people's stories, and to identify with the similarities, to develop that universality, things that we are all going through, things that everybody who has an addiction problem suffers from. And that freedom from isolation and freedom from aloneness is therapeutically incredibly valuable.
Here at Houghton House, we have a multidisciplinary team who all work together to achieve an individualized treatment plan for each of our patients. We have a team consisting of addiction counselors, social workers, occupational therapists, clinical and counseling psychologists. We also have a medical team as well as a psychiatrist to ensure that we are treating our patients holistically. We meet as a team every week to discuss each individual patient, the progress that they are making, as well as the challenges that they are facing in order to develop their individualized treatment plan.
Most people are surprised, pleasantly surprised, by their experience of treatment. At Houghton House we develop a nurturing, non-judgmental and comfortable environment in which people can take an honest look at themselves and their relationship with drugs.
At Houghton House we're very focused on assisting people to get to a year of clean time. The research tells us that if you can get to a year, the chances are that you will probably stay clean and sober.
Recovery has to happen in every area of your life. Psychological, emotional, spiritual, and of course physical.
We look at treating addiction in a holistic manner, which means that we focus on treating the biological, the psychological, as well as the social aspects.
We've got groups and individual sessions and lectures and family support where sometimes even if loved ones have been clean for a year or two, family members will still be attending.
What we're finding is that people are more open to coming into treatment centres once they realize that there's nothing to be ashamed of, and that other individuals who have come through treatment centres and have long-term sobriety speak of their life story and speak of how this disease has changed their lives and how coming into treatment has changed their lives for the better.
We want our patients to live considered lives, to think about what they're doing, how they're behaving, how they're responding, and to take responsibility for their own part in what's playing out.